Hello, my dear budding doctors. I welcome you all to my YouTube channel, Americo's Notes. This is the second part of our video, that is the important short answers of lower limb. I hope you all saw the previous video, the part one of this lower limb. I hope you all loved the previous video. So, let's move on to this session. The first question we'll be seeing is the spring ligament. Actually, we all know the location of spring ligament is in the foot. Yeah. So, the spring ligament complex is a group of ligaments that connect the calcaneum and navicular and support the talus. So as you all know, the spring ligament is actually a complex ligament complex, okay, and it constitutes of three ligaments which is coming under the spring ligament, and they all together they connect the calcaneum and navicular bone and also provides the support to the talus bone. Okay, so as you can see in this picture, this is the calcaneus. Okay, this is the calcaneus and this is the navicular bone. This is the navicular bone. This spring ligament connects the calcaneus and navicular, and also it provides a support to the talus bone. Okay, now moving on to the second point, the spring ligament complex has three components. So as you all know, it is a the spring ligament is a complex of ligament. It constitutes three ligaments under it. Okay, so the first one is the supramedial ligament. The second one is the medioplantar oblique ligament. The third one is the inferior plantar longitudinal ligament. So look at this picture. This is a superior, the supramedial ligament is located superiorly. The medioplantar oblique ligament is located along the medial side, and the inferior plantar longitudinal ligament is located inferiorly. Okay, now, the first point is a supramedial ligament forms a sling suspending or articulating against the head of thallus. So they say that the supramedial ligament it forms a sling along the head of the thallus. So head of the thallus is located here, and the supramedial ligament forms a sling along the head of the thallus. Okay, now moving on to the next point, it says the origin and the insertion of supramedial ligament. So the origin is from the sustangulum talus with a wide insertion into the navicular bone. Okay, now as you can see here, this is the this is a supramedial ligament. Okay, this is a supramedial ligament, and they say the origin of it is from the sustangulum talus. So here the sustangulum talus, so I have given here sustangulum talus is actually a bony shelf located in the anteromedial surface of calcaneus bone. Okay, now this is the calcaneus bone. Okay, and along the anteromedial surface of calcaneus bone there is a bony shelf. This bony shelf is known as the sustangulum talus, and so they say that the supramedial ligament originates from the sustangulum talus, and it inserts in the, this is the navicular bone. Okay, so it inserts into the navicular bone. Now third point is this is the strongest and most important longitudinal arch stabilizer. So these ligaments, they form the most important function of this ligament is to provide the they are the arch stabilizers of our both foot. Okay, so it is the most strongest and most important one among all these three. Okay, now moving on to the next one, medioplantar oblique ligament. So as you can all see, the medially located this ligament is the medioplantar oblique ligament. Okay, it is also known as lateral calcaneonavicular ligament. Okay, so that's it for this point. The third point is that about the inferoplantar longitudinal ligament. So the other name of, so you can see in this picture, this is the inferiorly located one is the inferoplantar longitudinal ligament. The other name of this is intermedial calcaneonavicular ligament. Okay, and it also has a minor role in stabilizing the longitudinal arch. Now, the third clinical importance of the spring ligament is that if these stabilizes, that is, if any one of these ligaments is not properly developed or underdeveloped, or if there is loss of these ligaments, then this leads to hindfoot valgus and pes planus. So, do you all know what is hindfoot valgus and pes planus? No. Okay, so hindfoot valgus, the picture A shows hindfoot valgus. Okay, this hindfoot valgus and pes planus both are actually postural deformity. In hindfoot valgus, what is happening is that here mid calcaneal axis there is a deviation from the midline of the body. Okay, so as you can see in this picture, the in right leg there is a deviation, and in the left leg it is a normal foot. So in left leg in right leg what is happening is that there is a deviation from the mid calcaneal axis. Okay, now in pes planus you can see what is there. This pes planus is also known as flat foot, and what is happening here is that there is loss of, if either there can be loss or they can be flattening also of the medial longitudinal arch. So if both of these things happen, if any one of this happen also, the the child will experience a flat foot. Okay, so flat foot other name is called pes planus. The next question is the iliofemoral ligament. So as you all know, the iliofemoral ligament is the strongest ligament in our body. Okay, so the first point is that iliofemoral ligament is a thick capsular ligament found on the anterior and superior aspects of hip joint. So this iliofemoral ligament, first one is the location. Where is it located? It is located in the hip joint. Okay. Uh, the second point is that it has an inverted Y appearance. So you can, as you can see in this picture, this is the this is the this band you can see here. This is the iliofemoral ligament. Okay, this is the iliofemoral ligament, and you can see it as an inverted Y. Y appears like this. This is Y. This is Y. Here it has inverted Y appearance. Okay. Now the third point is that it arises from the anterior inferior iliac spine and the acetabular rim and attaches to the intertrochanteric line of femur. So where is anterior inferior iliac spine located? In the ilium. Super. And it is also located below the anterior superior iliac spine. Okay, so below the anterior superior iliac spine in the ilium there is anterior inferior iliac spine. So as you can see here, this is the anterior inferior iliac line. Okay, and also along the acetabular rim, this the iliofemoral ligament origin is there. Okay, and it attaches to the insertion is in the intertrochanteric line. This is the femur bone, this is the intertrochanteric line. So it also, the iliofemoral ligament attaches into the intertrochanteric line of femur. Okay, now the fourth point is that the iliofemoral ligament is said to be the strongest ligament. We all know that point. And also it prevents the hyperextension of hip joint during standing. So the hyperextension of hip joint during standing is prevented by the iliofemoral ligament. That is the important function of iliofemoral ligament. Okay. Okay, now moving on to the next question, plantar aponeurosis. So what is plantar aponeurosis? It is the modification of deep fascia. Okay, yes, very good. The plantar aponeurosis is a modification of deep fascia which covers the sole. As you can see here, very clear, very beautiful picture. It has given thoroughly, properly the view of plantar aponeurosis. Okay, so I guess you can see here, this band, the sheath you can see here is the plantar aponeurosis. Okay, so it is thick, it is very thick in the centrally, and along the sides it forms a very thin sheath. Okay, so thick sheath in the middle and thin sheath along the sides. Okay, now the plantar aponeurosis is a modification of deep fascia which covers the sole. So deep fascia, it modifies as a aponeurosis in the foot. Okay, which covers, and it covers the sole. Second point is that it is a thick connective tissue that support and protect the underlying structures of the foot. So this modification of deep fascia is itself to protect the underlying structures of the foot. Okay. Now the third point is that the fascia is thick centrally, known as aponeurosis, and is thin along the sides. So as you can see here in this picture, it is given clearly along the centrally it forms a thick sheath which is known as aponeurosis, and along the sides it is a thin sheath. So this is along medially it is known as medial plantar fascia, and laterally the sheath is known as lateral plantar fascia. Okay, now the fourth point is that the fascia consists of three parts: medial, lateral, and central. Yes, we all know that this is medial part, this is the lateral part, and this is the central part. The next point is that the aponeurosis is triangular in shape. Yes, very good. That also we can appreciate thoroughly that this is triangular in shape. Okay, triangular in shape attachments. So posteriorly it is attached to the medial tubercle of calcaneus. So you can see here, this is the calcaneus bone, and posteriorly it is attached to the medial tubercle of calcaneus. Anteriorly what happens? Yeah, it divides into 5 processes, one for each dose. Okay, so for each dose it divides into 5 processes. On each side, what is happening? It is attached to the metatarsal bones by medial and lateral intermuscular septa. We can't see here, it is a bit deep, but just know it. Okay, on each side it is attached to metatarsal bones by medial and lateral intermuscular septa. Okay, super. Now moving on to the next point, the aponeurosis is good for protecting deeper structures of foot such as nerves and vessels, and to maintain the longitudinal arches of foot. Okay, now the important function of this aponeurosis is to protect the deep structures of our foot and also to maintain the longitudinal arch of our foot. Okay, yes. Now very easy question but very frequently asked question. There is high chances of asking this question in a 2 mark or 4 mark, also as a one word question. So please learn thoroughly this question. Okay, moving on to the next question. Trochanteric anastomosis, it's a very simple question. They can ask as a 1 mark also, they can ask a 2 mark also. Okay, so it is a short note, it's a short answer question for you. So uh, trochanteric anastomosis is nothing, okay, but anatomical structure that provides circulation around the head of the femur along with cruciate anastomosis. So this head of femur, the blood supply to the head of femur is provided by two anastomosis. One is a trochanteric anastomosis and another one is a cruciate anastomosis. These both are important short answers. I'll tell about cruciate anastomosis in next video. Okay, now trochanteric anastomosis is a, see, this is the head of the femur, and this trochanteric anastomosis provides blood supply to the head of the femur along with cruciate anastomosis. Okay, now it is formed by, so this mostly they'll ask the uh, formation of trochanteric anastomosis. What are the arteries constituting a trochanteric anastomosis? So it is formed by, see the first one, deep branch of superior gluteal artery. Can you see here? This is the deep branch or the descending branch of superior gluteal artery. So this constitute a artery. Now the second one is the ascending branches of both lateral and medial circumflex arteries. So see here, this is ascending branch of medial circumflex artery and this ascending branch of lateral circumflex artery. So these both arteries also constitute trochanteric anastomosis. And the fourth one is the inferior gluteal artery. So can you see here? This is the inferior gluteal artery. So the first one is a descending branch of superior gluteal artery. The next one is a branch of inferior gluteal artery, and the other one is the ascending branches of medium circumflex artery, and the other one is the ascending branch of lateral circumflex artery. It is very easy to remember. Okay, so that's for trochanteric anastomosis. Moving on to cruciate anastomosis. So the cruciate anastomosis, nothing but it is also the same. It also provides blood supply to the femoral head. Okay, along with trochanteric anastomosis. So the trochanteric anastomosis and cruciate anastomosis, these both provide the blood supply to the head of femur. Okay, now where is it situated? It is situated in the upper part of back of thigh at the level of lesser trochanter of femur. See, along the lesser trochanter of femur, this cruciate anastomosis is situated. Okay, now what are the arteries participating in cruciate anastomosis? These four arteries are the important ones you have to remember. Okay, now first one is a transverse branch of lateral circumflex femoral artery. Can you see here? Yes, this is the transverse branch of lateral circumflex femoral artery, and the other one is the transverse branch of medial circumflex. So lateral circumflex, lateral medial circumflex, the transverse branches of both, they constitute the parts of cruciate anastomosis. Okay, and the third one is the descending branches of inferior gluteal artery, and the other one is the ascending branches of first perforating artery of what? Deep femoral artery. Okay, so descending branches of inferior gluteal artery and ascending branches of first perforating artery from the deep femoral artery. Okay, so these four constitute the cruciate anastomosis. So as you all know, what are they both? They both provide the blood supply to the head of the femur. Where is it located? Along the lesser trochanter, and then you have to write the four arteries constituting the cruciate anastomosis. Okay, okay, now that's it for this session. So altogether I have covered a list of 10 questions. These 10 questions are very important to be revised as short answers in the board exams. So I hope this video was very useful for you. If you have any suggestion, you can drop in the comment box below. It will be useful for me also. Okay, so that's it for this video. Thank you so much, doctors, for listening. Thank you.